Welcome back, YouTubers, to my channel, An Everyday Life of an Aspie. If you're following me right now, I'm doing something different. Even though, yes, if you're new to my channel, I better introduce myself before I continue on. I'm AspieAnswersAll, or I'm known by many people Aspie. And at this point of time, I'm doing some stuff about, health stuff, but be it, your body systems and the body systems disorders that will come under different, categories into that body systems, obviously, so that you know what the causes are, the triggers, the signs and symptoms of the body system disorders versus treatment if there's any, or some form of therapy. So this one's all about the connective tissue, or kind of body disorders sort of thing, system disorders, shall I say, correction there, so that hopefully that you can get a lie down of what it is and everything else. So let's begin this before I lose track of time. So EDS, or as its long-term word is, Ehlers-Danlos syndrome. You may be questioning to me, what is it, Karen or Aspie? Well, this is a group of like genetic connective, tissue disorders. Okay, the symptoms will vary from person to person, like many other symptoms that comes into the territory of some body system disorders that I will be addressing later on in the piece, that will be broken down into your anatomy and physiology. But for now, this one obviously will vary from mildly loose joints to life-threatening complications such as aortic dissection, chronic pain, or earlier osteoarthritis may likely to occur in this. Okay, this is caused by a defect in the structure, production, or processing of collagen, or proteins that interacts with the collagen. Collagen in the connective tissue, however, that helps resist deformation. Okay, this collagen is a contributor pretty much. The physical strength tissue, abnormal collagen renders these structures more elastic. In some cases, it can be life-threatening for some, like many other disorders, however, that I've mentioned, especially people who suffer from joint pain or chronic just pain in general, be it not just, the joint pains, however, are likely to be misdiagnosed, such as, they may be diagnosed with hypochondriasis, depression, chronic fatigue syndrome, which I'm going to bring into some of that again, as I said later on in the page, but for now we're focusing on this. Or other conditions that are similar to what I shared easier, or shall I say earlier in my videos. I'm trying to read my writing as I'm trying to recall everything, sorry. But medical disorders that can interact with each other with similar symptoms, regardless what it is, making it harder to diagnose. So you can refer back to that video, basically based on the very introduction of, what is suspicious syndrome and whatnot. I'll link it to this channel if this video, so that maybe you can get a clearer understanding. But for now, let's continue on this, so to speak. So the signs and symptoms, as I just said before, will vary widely based on which type of EDS the patient may have. However, because there are many different types that affects patients in different categories, and however the signs are ultimately due to faulty or reduced amounts of collagen. EDS, which I'm going to shorten it for you, is typically affecting the joint, skin, and blood vessels. So below are the list of major signs and symptoms. So in your musculoskeletal system groups, this will include of the signs and symptoms. Number 1, hyperflexible joints. This may be possible to be very flexible or may have double joints, but this is not always the same as EDS, however, just to bear in mind. Number 2, unstable joints that are prone to maybe sprain, dislocation, subluxation, and hypertension. Number 3, thoracic outlet syndrome. Number 4, early onset of advanced osteoarthritis. Number 5, chronic degenerative joint disease. Number 6, swan neck deformity of the fingers. Number 7, Botonia deformity of the fingers. Number 8, tearing of the tendons or muscles. Number 9, deformities of the spine such as scoliosis, which is the curvature of the spine, or kyphosis of thoracic hump, tethered spinal cord syndrome, and occipital hypermobility. Okay, another one for this musculoskeletal group is myalgia, which is your muscle pain, or arthralgia is your joint pain, which may be severe in some cases. For the skin, however, obviously it tends to be fragile, that will likely to tear easily. Atrophic cigarette kind of paper scars. It may easily bruise, redundant skin folds, molluscoid pseudotumors, especially on pressure points, subcutaneous spheroids, and livedoid reticulars. And your cardiovascular part of the system there for your, disorder of this one I'm sharing is number 1, arterial rupture, number 2, valvular heart disease such as mitral valve prolapse, which actually creates an increased risk for infective endocarditis during surgery. This may progress to a life-threatening kind of degree. Heart condition abnormalities have been found in these with hypermobility form of EDS, dilation and or rupture aneurysm of ascending aorta, postural orthostatic tachycardia syndrome, Raynaud's phenomenon, varicose veins, heart murmur, heart conduction abnormalities. Other manifestations or complications: hiatal hernia, gastroesophageal reflux, gastrointestinal dysmotility, dysautonomia, which will be coming up soon, Gullen sign, which is a touched tongue to nose, anal prolapse, collapse, lung, nerve compression disorders such as your carpal tunnel syndrome, neuropathy, acroparesthesia, insensitive to local anesthetics, your brain disorder like your Arnold-Chiari malformation, platelet aggregation failure, platelets that don't obviously clump together properly, pregnancy complications, increased pain, mild to moderate peritoneal bleeding, cervical insufficient uterine tearing or premature rupture of membranes, sleep apnea, cranial vertebral instability caused by traumas to the head and neck areas such as concussion and whiplash. Ligaments in the neck are unable to heal properly, however. Therefore, the neck structure doesn't have the ability to support the skull, which then can sink into the brainstem, blocking the normal flow of spinal fluid, leading to tissues related to the autonomic nervous system. Right, and the genetics, however, just to bear in mind, hopefully if I can bring it down shortly, as I've mentioned before, under the classification above, of what I'm sharing, there are some variations of this can be possibly identified as tied to specific genetic variation, which number two things, mutations in the following genes can cause subtypes of the Ehlers syndrome. Fibrous proteins in your enzymes is 1 and 2. Number 1. Well, shall we say mutations, however, in these genes usually alter their structure, production, or processing of collagen or proteins that interact with the collagen. Collagen provides structure and strength in the connective tissue. A defect in the collagen can weaken connective tissue in the skin, bones, blood vessels, and organs, resulting in the features of this disorder. Inheritance patterns, however, depends on the type of, as I said before, Ehlers Danlos syndrome. Most forms of the condition are inherited in an autosomal dominant pattern, which means only one or two of the two copies of the gene in question may be altered to cause this disorder. The minority are inherited in an autosomal recessive pattern, which means both copies of the gene must be older for a person to be affected by the condition. It can also be an individual de novo or sporadic mutation. Okay, diagnosis, obviously, for this to be involved can be made by an evaluation of medical history and clinical observation. The Brighton criteria is widely used to assess the severity of joint hypermobility. DNA and biochemical studies can help identify affected individuals. Diagnostic tests include collagen gene mutation testing, collagen typing via skin biopsy, echocardiogram, and lysyl hydroxylase or oxidase activity. However, these tests are not able to confirm all cases, however, and in any instances of an unmapped mutation, so sometimes clinical evaluation by geneticists may remain essential. If there are multiple affected individuals in the family, it may be possible to perform prenatal diagnosis using a DNA information technique known as a linkage study. Okay, obviously, as I said before, there are so many types of these, which I'm hoping to bring out more of hopefully later on if need be. But for now, there are certain differential diagnoses or disorders that share some of these characteristics with this EDS. For example, in cutis laxa, the skin is loose, hanging, and wrinkled. In EDS, the skin can be pulled away from the body but is elastic and retains the more when let go. In Marfan syndrome, the joints are very mobile and similar cardiovascular complications may occur. People with EDS tend to have a Marfanoid appearance. However, physical appearance and features in several types of EDS also have characteristics, including short stature, large eyes, and appearance of a small mouth and chin due to a small palate. The palate can have a high arch, causing dental crowding. Blood vessels can sometimes be easily seen through transparent skin, especially on the chest. Management for this is, as I would say, is there's no cure or magic fix for EDS, but treatment is palliative. Basically, it can also be supportive that includes close monitoring, and also just to bear in mind also that this is a long-term disorder. So treatments in this, however, of the management, however, is close monitoring of the digestive, excretory, and particularly the cardiovascular systems is important to take in place. Also for management, there can be physiotherapy, occupational therapy, and orthopedic instruments, e.g. wheelchairs, bracing, casting may be helpful for some patients. However, orthopedic instruments are helpful for the prevention of further joint damage, especially for long distances, although it is advised that many of individuals not become entirely dependent on them until there are no other options for mobility. One should avoid activities that could cause the joint to lock or overextend. Sometimes some physicians may prescribe casting to stabilize joints. Physicians may refer a patient to an orthotist for orthotic treatment, such as bracing. Physicians may also consult a physical doctor, occupational therapist to help strengthen muscles and teach people how to properly use and preserve their joints. There are many different types of physiotherapy. Aquatic therapy promotes muscular development and coordination. With manual therapy, the joint will be gently mobilized within range of motion and manipulations. If conservative therapy isn't successful or helpful, surgical repair of joints may be necessary. Medication to decrease pain or manage cardiac, digestive, or other related conditions may be prescribed. To decrease bruising and improve wound healing, some patients may have been responded to ascorbic acid, which is your vitamin C. Special precautions, however, are often taken by medical care workers because of the sheer amount of the complications that tend to arise in EDS patients. In vascular EDS, however, signs of chest or abdominal pain are to be considered trauma situations. In general, medical intervention is limited to symptomatic therapy. Before pregnancy, patients with EDS should have genetic counseling and familiarize themselves with the risks to their own bodies that pregnancy poses. Children with EDS should be provided with information about this disorder so they can understand why contact sports and other physical stressful activities should be avoided. Children should be taught early on that demonstrating the unusual positions that can maintain due to loose joints shouldn't be, done, as this may cause early degeneration of the joints. Patients may find it hard to cope with the drawbacks of the disease. In this case, emotional support and behavioral and psychological therapy can be useful. Support groups can be immensely helpful for patients dealing with the major lifestyle changes and the poor health that's included in this. Despite all these types of conservative therapy, except bracing, research have shown that conservative therapy is ineffective in contrast to mid-carpal instability in normal patients. L. Rumbert showed that in almost 40% of the cases, conservative therapy has a natural or even a negative outcome. Conservative therapy may be unsuccessful in controlling instability in the long term. Okay, basically, surgery, the instability of joints leading to subluxations and joint pain often requires surgical intervention in patients. Instability of almost all joints can happen, but appear most often in the lower and upper extremities, with the wrist, fingers, shoulder, knee, hip, and ankle being the most common of these factors. Common surgical procedures, however, are joint debridement, tendon replacements, capsularrhythmia, and arthroplasty. Studies have shown that after surgery, degree of stabilization, pain reduction, and patient satisfaction can improve, but surgery doesn't guarantee an optimal result. Patients and surgeons may report being dissatisfied with results. Studies have shown that local anesthetics, arterial catheters, and central venous catheters can cause a high risk in hematoma formation in patients. Also, patients with EDS show a resistance to local anesthetics. Prognosis, basically, you know, the outlook for individuals with EDS will depend on the type of EDS, as I said. Symptoms will vary in severity even within one subtype, and the frequency of complications changes individually. Some people have negligible symptoms, while others are severely restricted in their daily life. Extreme joint instability, chronic musculoskeletal pain, degenerative joint disease, frequent injuries, and spinal deformities may limit the mobility of the patient. Severe spinal deformities may affect breathing. In many cases of extreme joint instability, however, dislocations may result from simple stuff such as rolling over in bed or just simply turning a doorknob. Secondary conditions such as autonomic dysfunction or cardiovascular problems occurring in any type can affect prognosis and quality of life. Severe mobility-related disability is often seen more in hypermobility type than in the classical type or vascular type EDSs. Although all types are potentially life-threatening, the majority of individuals will have a normal lifespan. However, those with blood vessel fragility have a high risk of fatal complications. Arterial rupture is the most common cause of sudden death in EDS. However, basically, this quickly ends the part of EDS of the bodily systems of it all. Give me the like for thumbs up for support, comment below or share your stories, basically if you suffer from this and how you get by with it all, so that we can create an awareness, understanding, and educate each other, so to speak. Feel free to subscribe to my channel if you haven't done so already. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to share these videos around to educate one another or share your life experience, what have you, whatever the main reason. And all for the do, guys, do what you love what you do. Until next time, Aspie signing out. I'll see you all again soon. Ciao for now.